According to the World Health Organization, COVID-19 infections and hospitalizations among people aged 25 to 59 are increasing at an alarming rate. 90% of youth are affected by the pandemic worldwide. Today on the program, our focus is on the recently launched Global Youth Mobilization to cushion effects of the pandemic. I am Olasumbo Modupe. Welcome to Sound Health. We begin with COVID-19 update.
The COVID-19 pandemic continues to intensify globally. According to the Director General of the World Health Organization, Dr. Tedros Ghebreyesus, cases have now increased for the 9th straight week, and deaths have increased for the 6th straight week. He added that there were almost as many cases globally last week as in the first 5 months of the pandemic. He explained that while it is pleasing to see small declines in cases and deaths in several regions, many countries are still experiencing intense transmission, and the situation in India is beyond heartbreaking. However, WHO is doing everything in providing critical equipment and supplies, including thousands of oxygen concentrators, prefabricated mobile field hospitals, and laboratory supplies. WHO has redeployed more than 2,600 staff to support the response on the ground, providing support for surveillance, technical advice, and vaccination efforts. In Nigeria, more than 164,000 confirmed cases, over 154,000 discharges, and 2,062 deaths have been reported. Globally, there have been more than 146.8 million confirmed cases of COVID-19, including over 3.1 million deaths reported to WHO. Above 933,824,012 vaccine doses have been administered.
It's the Sound Health on Lagos Television. Young people around the world can now apply for funding to support innovative local solutions to address the impact of the COVID-19 pandemic as part of a new initiative called the Global Youth Mobilization. My guest today is Adebisi Adenipekun. He is a public health expert. Welcome, Adebisi.
Thank you, Modupe.
Okay, according to the World Health Organization, COVID-19 infections are increasing among people aged 25 to 59. It's at alarming rate. What could be responsible for the toll among younger adults now?
Yeah, there could be multiple reasons for this, and like you said, this is what we are observing globally at the moment. Some of the explanations that have been put forward for this is broadly divided into three main prongs. The first is risk and perception of risk by young people. The fact that for some reasons there has been communications around the prognosis of COVID-19 among older people, the fact that they come down with severe illness and many of them don't survive. And that, in a way, has made younger people have that sense, that false sense of security that they cannot come down with COVID-19. That perception of risk has affected their attitude. So we have a lot of young people out there not taking necessary precautions, not wearing their mask, not observing physical distancing. Some of this attitude and perception of risk has influenced the the way they come down with the disease. And that has also, in a way, contributed to the number of people we have on admissions and people that are hospitalized. Just a sequel to that is also the fact that people at the working age range are young people. So young people need to survive, they need to go to work. Not many are mobile, so they have to use public transport. That further exposes them to getting infected with COVID-19. So these are some of the explanations. That's one. Then the second prong is the fact that for prioritization of people that will get COVID-19 vaccine, young people are among the least prioritized. So they also don't have that cover that comes from immunization, and this is speaking to what has been observed even in developed countries that have higher uptake of vaccine. So this explains why we have more young people now. That spike in young people being hospitalized, and then there are also some reports around the fact that the B117 variant of COVID-19 being highly contagious, and that is also bringing young people down, equally as it is bringing geriatrics down. So those are some of the explanations to why we are observing the spike in young people, coming down with COVID-19 and even being hospitalized, as opposed to the trend we observed at the beginning of the pandemic.
Okay, but with this alarming rate, we have the vaccination. Most countries have started vaccinating people in this age bracket, unlike in other countries. For instance, now in Nigeria, we are still vaccinating the frontline health workers. Don't you think with the vaccination exercise, the rates, the cases should be reduced by now?
Like I mentioned earlier, the vaccination, there's something called herd immunity, in which you have vaccinated a lot of people to the extent that we can now have a reduction in the community spread of that disease. More people are prevented or protected rather against the disease because the significant percentage of the population are being populated. In our own in a country like Nigeria, we don't even have enough vaccines to, go around the entire population. I mean, we received just a little less than 4 million doses of COVID-19 vaccine in the country that has over 200 million population. So definitely there has to be prioritization. And for the prioritization, the health workers are to be prioritized, the frontline workers are to be prioritized, the first responders are to be prioritized, and of course, the influencers, the leaders, the people that can drive demand for the vaccines are to be prioritized. So that is the approach that has led into the people that are given the vaccine now. But in terms of how vaccination should affect the rate of young people coming down with COVID-19, I agree with you, that should affect, and that is what is expected. But because young people have not been vaccinated well enough, and that can even explain why we have more of them now. The older age group in countries like US, they have prioritized the older age group. They have well been, vaccinated, and there has been a reduction in the number of older people coming down with COVID-19. But the young people that haven't been vaccinated are the ones, being hospitalized at the moment. So I think it's logical. We have not been vaccinating young people enough, even in developing countries. So even in developed countries like US, and so they are the ones, being hospitalized more. In developing countries like Nigeria, we don't have enough vaccines to go around our population, and we have not even started with the young people population. So we are seeing what we should expect actually.
Okay, despite efforts at making progress, issues keep coming up, but the World Health Organization is being proactive with the launch of this new initiative.
So the Global Youth Mobilization is a bold move by the big six youth-led organization in the world, and they are collaborating with WHO and United Nations Foundation to have youth-led solutions for the pandemic. And the approach is that we don't just want to respond to the pandemic, but we want to have resilience. We want young people and their innovation and creativity to make us have a greater comeback after the effect of the pandemic on the economy, on people. And so what exactly is the global youth mobilization? This is an opportunity. It's an opportunity for young people to apply for grants. 2 million US dollars has been committed to investing in young people through this global youth movement, and they want to invest that into young people's ideas, their innovation, and their future. And how are young people going to enhance this fund? It's going to be a grant that is available across 4 tiers, ranging from $500 to $5,000, and the expectation is that young person, as an individual or youth-led organizations or community-based organizations at the grassroots level, can apply for these grants. I think one interesting thing about this global youth movement is that it is entirely youth-led. So we're talking about a process that is initiated by youth, and that youth will be the judge in their own matter. So as people are turning in their applications, it is being reviewed by young people, young people that understand the context and the challenges of, their peers, and how the COVID-19 has affected, young people. And I think one important point to address is, why is this global youth movement? The fact that as we speak today, many people have lost their job due to the effect of COVID-19, from the disease itself to the lockdown, to the measures put in place, to the devastating effect on the economy that has made many companies to downsize. And again, people in the work age range are young people. So that's devastating effect of COVID-19 affects young people more, and that speaks to why this global youth movement, is such a need, is such a timely intervention at this point in time. Also, to speak to the fact that young people want to be at the driver's seat of things that affect them. So COVID-19 does not affect old people alone. Young people are being infected. Young people are dying. Young people have parents. Young people have lost their parents to COVID-19. So if it affects young people, if it affects us, then we should also drive the solution. And finally is the fact that young people are daring. Young people are audacious. We take risks. So our creative energy at this point can be harnessed to not only make the world respond to COVID-19, but to also prepare the world for future, pandemics, to make us resilient. And we are resilient enough. And we have seen this, in a country like Nigeria, where young people have come up with innovative solutions to, come to provide platforms for people to get medical care, talk about well-use health, to laboratory, testing centers, mobile laboratory testing centers, to some smart innovations that make people access healthcare rather than going to the hospital, telemedicine. These are some of the things that young people are doing that, to respond to COVID-19, and these are things that we should sustain sequel to the pandemic.
Okay, so I'm going to ask you 2 questions. Now, it is encouraging that we have youth leading the panel now. What are the criteria for these grants, and how do I 3 questions actually? How do I qualify for the grant, and what are the solutions? They have to be innovative but yet local at the same time.
You're right, Modupe. The criteria to start with for the grants is that you have to be young. You have to be between the age of 14 to 30. And that is the most important criteria as far as this global youth movement is concerned. You just have to be young. There's no restriction. There are no restrictions in terms of where you're from, in terms of gender, in terms of race. There are no restrictions. You just have to be young, within the age brackets, and then you qualify for the grant. However, what are the kind of innovation, what are the kind of proposals or projects that will be funded? It has to be innovative. And the mantra is that you are thinking globally, you are acting locally.
Okay.
So think global, act local. What exactly is the effect of the pandemic to you, on you and your immediate environment? And what are you doing to solve the problem? And that is why the jury will be young people that understand the context from which you're applying from. So it's not a one cap size that fits all approach, and it's not about high sounding ideas, as much as we say that it has to be innovative, the important thing is that it is solving a problem. It has high impact potential, and it is locally applicable. It is something that is realistic, that is feasible, to your local context, and that's about the main criteria that you need to tick before you apply for this.
Are we going to look out for vaccines, launch of vaccines, or development of vaccines in each communities or each countries?
So, development of vaccines by nature are very expensive, and it is actually a very, very technical and cumbersome process. The fact that we got COVID-19 vaccine developed in record time does not mean that it is a very simple process. So, and the grants, again, the entire money invested for this grant is $2 million. That is really low compared to what you need to develop a vaccine. But to take that question forward, I would think that if young people can come up with innovative ways to deliver vaccines to the last mile, for instance, there are people, that due to their geographical location, they are not generally accessible, to health workers, to information about the vaccination. If we have the vaccines, we have enough supply of the vaccines, these people may not still get the vaccine. So if someone is coming up with an innovation that can ensure that we don't leave anyone behind, those are things that I'm pretty sure may fly with the jury. Yeah.
And I wish them success. I hope the best of the best wins the grant.
Yeah.
Okay,
I hope
so
so too.
all right, so this initiative is a clarion call to governments with little or no inclusion of youth in their policies. As a strategy and policy expert, what should be the way forward in terms of moving away from this traditional approach?
Yeah. So the traditional approach is that young people are not on the table, right?
Yes.
They are not part of the decision making, they're not part of the strategic planning. And truth be told, that is shifting. We are seeing young people on the table right now. We are seeing, of course, some of them are still behind the scenes, but you know that a lot of things that you see in media as it relates to COVID-19 response, as it relates to government intervention, there are young people thinking through the process, and but the important thing is not to be tokenized. The important thing is for young people to be part of the process and to be duly accorded what it takes to be on the table, all the honor, all the recognition and accolades that comes with being on the table. And I think that I will answer that question in two prongs. One from the young people's perspective, and the other from the government and the leaders' perspective. From the young people's perspective, what brings us to the table is actually competence. And so it is important for every young person out there that wants to contribute to policy making, that wants to contribute to national development, to build the necessary capacity to do so. It's no longer about carrying placards or carrying placards. Of course, I know that there are times that we need to protest, but it's all about speaking that technical language that gets people on the table. And that means that we need to build capacity on agenda setting, on policy making, on negotiations, high level negotiations, on drafting policies, pushing policies through the appropriate quarters, So those are some of the required competencies: proposal writing, grants writing, just to mention a few competencies that are required to get on the table. And no one denies results. If you bring something valuable to the table, nobody will remember your age, nobody will remember your sex, or
Absolutely.
So my clarion call to young people out there is get the competence, opportunity will come. That's the truth. And if you have the competence, you discover that you can actually create the opportunity for yourself. There are problems, out there to be solved. When you solve those problems, you naturally get the recognition and the attraction that comes with it. But the second point, which I think is very important and cannot be overemphasized, is the fact that the leaders, our current leaders, need to understand the importance of succession strategy. You cannot be a successful leader if you are not succeeded by someone that is capable and competent and can do better than you. And this is against the traditional, in quotes, African perception that you must be the hero. We must move away from being the star, to being the makers of stars. So my current call to everyone, I hope they're in their 50s and their 60s. Definitely we will also get to 50s and 60s one day, you understand? But my current call to them right now is, what is your succession plan? Who are you grooming? Who are you mentoring? Who are you building his or her capacity to, do better than you when you leave the scene? Yeah, over.
Okay, you're parting shot now to the youth now to beat the pandemic, and as well to be impactful beyond the pandemic, because I know there is going to be the post-COVID era.
Yeah, yeah. So for all young persons out there listening to me, I want to strongly advise that you leverage the the beauty and the strength of this difficulty to make something out of your life. And I'll explain what I mean. For every time that has been shift in in global economy in terms of richest men in the world, and strategic shift in economy, it has come from hardship, from a global recession, to a change in consumer behavior, So COVID-19 pandemic presents us another opportunity to do things differently. So young people out there, you might have been locked out of school, you might have been, restricted to your devices and your houses. But this is the time for you to think, what can I do differently? How can I make sense out of my life, despite the pandemic? And you discover that there are many opportunities out there, even on your phones, that you can leverage at this point, that will make you, be a better person. One of the things that we have discovered through this pandemic is higher rate of mental illness, among young people, because people slip into depression, people slip into all forms of mental disorders at this point. And this is a clear call to every young people: get engaged, get meaningfully engaged, despite the pandemic, and plan for post-pandemic era. How do you plan for post-pandemic era? Build your capacity, learn a skill, that is relevant for the future of work. Future of work is another conversation that is beyond the scope of this interview, but you may want to go and check up on that. What are those skills that will be required post-pandemic? And you want to build yourself. Don't restrict yourself to what you trained in school. I trained as a pharmacist, but I can't remember when last I dispensed a drug. You understand? So it's all about understanding what it's required for you to contribute to making the world a better place.
All right, thank you so much, Adebisi, for your insights on the show today. We really appreciate you.
Thank you for having me.
My guest today has been Adebisi Adenikpefun, a public health expert. He has been giving insights on the newly launched youth mobilization program by the World Health Organization. Sound Health continues with trending health reports. Please stay tuned. This is where we wrap up today's episode of Sound Health. For comments and inquiries, please send SMS to 08035826603 or follow us on social media at LTV Social #Sound Health. A sound health is a sound mind. Make healthy living your choice. Please stay safe always.